A student ate 5-day-old pasta for lunch. This is what happened to his liver. Jake is a 20-year-old college student studying mechanical engineering at a state university. Like many students living off campus, he meal prepped on Sundays to save time and money during the week. That particular Sunday, he'd made a large batch of spaghetti with tomato sauce, enough for 5 days of lunches. He cooked the pasta, mixed it with sauce, divided it into containers, and left them on his kitchen counter to cool. But Jake got distracted. A gaming session with friends ran late into the night. He fell asleep on his couch. The pasta sat out at room temperature for approximately 8 hours before he finally moved it to the refrigerator Monday morning. Fast forward to Friday. Jake grabbed the last container from his fridge, pasta that was now 5 days old. He was running late for his afternoon lecture. No time to reheat it properly. He microwaved it for maybe 45 seconds, just enough to take the chill off, then ate it quickly in his car. He's presenting to the emergency department 4 hours later. Jake arrived at the ED complaining of severe abdominal cramping, nausea, and profuse vomiting that started about 2 hours after eating. The attending physician, Dr. Sarah Chen, initially suspected acute gastroenteritis, a common diagnosis for food poisoning. His vital signs showed a heart rate of 118 beats per minute. Tachycardic, meaning elevated. Blood pressure was 108/72, slightly low. Temperature was 38.9 degrees Celsius, or about 102 Fahrenheit. He was running a fever. But what concerned Dr. Chen was Jake's appearance. His skin had a subtle yellowish tint. His sclera, the whites of his eyes, showed obvious jaundice. Jaundice after just 4 hours of food poisoning symptoms? That wasn't typical. She ordered a comprehensive metabolic panel and liver function tests. The results came back 45 minutes later, and they were alarming. Jake's ALT, alanine aminotransferase, was 2,147 units per liter. Normal is 7 to 55. His AST, aspartate aminotransferase, was 3,212 units per liter. Normal is 8 to 48. These are enzymes that leak from damaged liver cells into the bloodstream. When liver cells rupture, these levels skyrocket. His total bilirubin was 4.2 milligrams per deciliter, more than double the upper limit of normal. Bilirubin is the yellow pigment that causes jaundice. It's what made his skin and eyes yellow. Most concerning, his INR, or International Normalized Ratio, a measure of blood clotting function, was 2.8. Normal is around 1.0. His blood wasn't clotting properly. The liver produces clotting factors, and when the liver fails, so does coagulation. Dr. Chen immediately called the hepatology team. Jake wasn't just experiencing food poisoning. He was in acute liver failure. Jake was admitted to the intensive care unit. But what caused this? Food poisoning doesn't typically destroy the liver in 4 hours. Dr. Chen needed answers. She took a detailed history, the 5-day-old pasta, left out overnight before refrigeration, microwaved inadequately. Jake mentioned the pasta had smelled a little weird, but not rotten. He ate it anyway. Dr. Chen suspected Bacillus cereus, a bacterium notorious for contaminating starchy foods like rice and pasta. But there was something else, something that made this case unusual. Let me explain what happens when pasta goes bad. Bacillus cereus is a spore-forming bacterium. The spores can survive boiling water, so cooking pasta doesn't eliminate them. When cooked pasta cools to room temperature, especially between 40 and 140 degrees Fahrenheit, what food safety experts call the danger zone, these spores germinate into active bacteria. Bacillus, from Latin meaning rod-shaped, cereus meaning waxy, referring to the colony's appearance. This bacterium produces 2 types of toxins. The emetic toxin causes vomiting within 1 to 5 hours. It's heat-stable, meaning reheating won't destroy it. The diarrheal toxin causes cramping and diarrhea within 8 to 16 hours, but Bacillus cereus typically causes self-limiting illness, unpleasant but not life-threatening in healthy adults. So why was Jake's liver failing? Dr. Chen ordered additional tests. She sent the leftover pasta, Jake's roommate had found the container in his car, to the microbiology lab. She also tested Jake's blood for other pathogens. The pasta grew Bacillus cereus, as expected. But there was something else. Heavy growth of Staphylococcus aureus. Staphylococcus aureus. Staphylo, meaning cluster, referring to the grape-like clusters these bacteria form. Coccus, meaning berry-shaped. Aureus, meaning golden. The colonies appear golden yellow. This bacterium is commonly found on human skin and in nasal passages. About 30% of people carry it asymptomatically. When Jake prepared his pasta on Sunday, he likely contaminated it with Staph aureus from his hands. Perhaps he touched his nose or face, or maybe he had a small cut on his finger. Staph aureus produces several dangerous toxins, but one in particular explained Jake's condition: toxic shock syndrome toxin 1, or TSST1. When contaminated food sits at room temperature for hours, Staph aureus multiplies exponentially and produces TSST1. This toxin is a superantigen. Let me break that down. Normally, when your immune system encounters a threat, it activates specific T cells, about 0.01% of your total T cell population. This targeted response eliminates the threat with minimal collateral damage. Superantigens are different. They activate up to 20% of your T cells simultaneously. This triggers a massive, uncontrolled immune response called a cytokine storm. Cyto, meaning cell. Kine, meaning movement. Cytokines are signaling molecules that coordinate immune responses. But in a cytokine storm, these signals become overwhelming. The immune system attacks not just the pathogen, but the body's own tissues. In Jake's case, the primary target was his liver. The liver is your body's chemical processing plant. Hepatocytes, the liver's functional cells, perform over 500 distinct functions. They metabolize toxins, synthesize proteins, produce bile, store glucose, and regulate countless biochemical pathways. Hepato, meaning liver. Cyte, meaning cell. When TSST1 triggered Jake's cytokine storm, inflammatory molecules flooded his liver tissue. These cytokines, particularly tumor necrosis factor alpha and interleukins, caused hepatocytes to undergo apoptosis, programmed cell death, apo, meaning away from, ptosis, meaning falling away, cell death. As hepatocytes died en masse, they released their contents into the bloodstream, ALT, AST, and other intracellular enzymes. The liver's synthetic functions collapsed. Without adequate clotting factors, Jake's blood couldn't coagulate. Without proper bilirubin processing, he developed jaundice. Without toxin clearance, metabolic waste accumulated. Jake was developing acute liver failure with multi-organ dysfunction syndrome. The hepatology team initiated aggressive treatment. They started intravenous N-acetylcysteine, a medication that can help protect remaining liver cells from oxidative damage. They administered fresh frozen plasma to replace clotting factors. They gave broad-spectrum antibiotics to eliminate any remaining bacteria-producing toxins. They monitored Jake for hepatic encephalopathy, brain dysfunction caused by liver failure. When the liver can't remove ammonia from the blood, it crosses into the brain and causes confusion, seizures, or coma. Encephalo, meaning brain. Pathy, meaning disease. They also watched his kidney function closely. The cytokine storm and systemic inflammation could cause acute tubular necrosis, kidney failure. They prepared for possible dialysis. By hour 12, Jake's mental status began declining. He became confused and agitated. His ammonia level was 187 micrograms per deciliter. Normal is below 40. He was developing grade 2 hepatic encephalopathy. The team administered lactulose, a medication that traps ammonia in the colon so it can be excreted rather than absorbed. They added rifaximin, an antibiotic that reduces ammonia-producing gut bacteria. The critical question: would Jake's liver recover, or would he need a transplant? The liver has remarkable regenerative capacity. If enough hepatocytes survive, the liver can rebuild itself. But if damage exceeds approximately 70–80% of liver mass, regeneration becomes impossible without transplantation. Dr. Chen consulted with the transplant team. They placed Jake on the transplant waitlist, Category 1A, highest priority, but they would watch and wait, hoping his liver would recover spontaneously. Over the next 48 hours, Jake's condition slowly stabilized. His ALT peaked at 4,103 units per liter on day 2, then began trending downward. His mental status improved. His ammonia normalized. His INR gradually decreased. By day 5, his liver enzymes were declining steadily. His bilirubin was improving. The surviving hepatocytes were regenerating. He was urinating normally. His kidneys had avoided permanent damage. On day 7, Jake was transferred out of the ICU to a regular hospital floor. On day 10, he was discharged home with outpatient hepatology follow-up. 3 months later, Jake's liver function tests were completely normal. His liver had regenerated. He was one of the lucky ones. So what happened here? How did leftover pasta nearly kill a healthy 20-year-old? The answer is a perfect storm of food safety failures. First, Jake left cooked pasta at room temperature for 8 hours, allowing both Bacillus cereus spores to germinate and Staphylococcus aureus from his hands to multiply. Both bacteria produce toxins. Second, he stored the pasta for 5 days. Even refrigerated, bacterial toxin production continued slowly. TSST1 is heat-stable. Microwaving for 45 seconds didn't destroy it. Third, he consumed a large portion quickly. The toxin load overwhelmed his system. This case mirrors several documented incidents in medical literature. In 2005, a family in Belgium experienced similar toxic shock after eating contaminated spaghetti. In 2011, a case series from Japan described multiple patients with acute liver failure from reheated rice contaminated with both Bacillus cereus and Staphylococcus aureus. The CDC estimates that Staphylococcus aureus causes approximately 240,000 foodborne illnesses annually in the United States, but severe cases like Jake's are rare, perhaps a few dozen per year. Most people experience brief gastroenteritis and recover. But for reasons we don't fully understand, possibly genetic factors affecting immune response, some individuals develop life-threatening complications. The lesson here isn't that all leftovers are dangerous. The lesson is that food safety practices exist for critical reasons. The USDA recommends the 2-hour rule. Perishable food should not remain at room temperature for more than 2 hours, or 1 hour if the ambient temperature exceeds 90 degrees Fahrenheit. After cooking, food should be refrigerated within this window. Leftovers should be reheated to an internal temperature of 165 degrees Fahrenheit, not just warmed. And leftovers should be consumed within 3 to 4 days of preparation. These aren't arbitrary guidelines. They're based on bacterial growth kinetics and toxin production rates. Jake made a series of small mistakes. Each one alone might have been harmless. But together, they created conditions for a catastrophic outcome. He left food out too long. He stored it too long. He reheated it inadequately. And he got unlucky. He carried Staphylococcus aureus that produced a particularly dangerous toxin. Today, Jake has fully recovered. He's back in school, finishing his engineering degree. He's also become an advocate for food safety awareness on his campus. He shares his story to prevent others from making the same mistakes. His liver, that remarkable organ with its incredible capacity to regenerate, rebuilt itself from the edge of failure. But not everyone is so fortunate. Acute liver failure has a mortality rate of 30–40% even with intensive care. Many patients require transplantation to survive. The human body is resilient, but it's not invincible. The difference between a harmless meal and a life-threatening emergency can be measured in hours, in degrees Fahrenheit, in the invisible multiplication of microorganisms too small to see. The leftover pasta sitting in your refrigerator right now is probably fine. But maybe, just maybe, double-check when you made it. And when you reheat it, do it properly. Because the stakes, as Jake learned, can be higher than you think.